But in terms of my aspirations, I would say I kind of see myself as a primary care doc for mental health. And I think our role as mental health providers is very unique, and that's how I get to that place, because there is really no other mental health provider that can do all of the things that we can do. Now, some psychiatrists can, so I don't want to discount that, but most psychiatrists are not doing psychotherapy along with medication management. Analysts do, but they're few and far between. Nurse practitioners are doing mostly medication management. They're not trained in human behavior and how to dig deep and to take it to the next level. And then everyone that obviously is not a prescriber wouldn't be able to do what we're doing. So again, primary care doctor for a unique sort of mental health wellness kind of approach. The other thing I kind of see us doing is moving towards a preventative model of therapy. So I think about a dentist. Think about back when I was a kid. I mean, we did have preventative dentistry, but it was probably not as honed as it is now. So you catch things before they happen. So I can see people coming in for mental health checkups. And I do have people, and we're not actually calling it that, but I've got patients that come in and we'll say, okay, like, where are you in your life now? And they may be patients that I've seen previously, and they've sort of plateaued and they want to kind of work on something else. So I think if you can catch things before and you can, kind of craft your life, that's another avenue or aspiration that I see in terms of, my benefiting patients or clients. There's nothing more profound to me than to sit with a patient and to listen to their own unique story and connect the dots for them. Everybody has their story. And if I'm able to say, okay, let's look at your genetics, let's look at the environment that you grew up in, and let's look at the patterns of behavior that you've developed to get you here. Where can we intervene in all these different this kind of continuum of your life so that we can move you into a more healthy direction. Medication management might be one of the interventions there. Maybe yoga, maybe psychotherapy. Maybe I send you to another medical provider that can help you with something else. So again, I see myself as kind of the overarching primary care person, and we will look at all of these different aspects and figure it out. Most of my patients I've worked with for many, many years. And so that's also kind of a gift. I know that not many psychologists have that, but I do. And so again, to get to see patients at different stages of their lives and be able to offer them different interventions is also very unique. So again, I think if I were to encapsulate it all, I think wellness model, preventative model, and kind of the primary care doc for mental health.